My name is Cheryl Cortese. I'm a National Marketing Director with the Juice Plus Company. I've had that wonderful privilege and prosperity and great happiness of being with this company now for 28 years and looking forward to all the years to come because it's a wonderful place to be and it's great people to work with. Also, just to give you a little history of our company itself, the Juice Plus Company is actually 44 years old. We entered the marketplace many years ago, really led by a young man who is still runs our company today, Jay Morton, and entered the marketplace with a product that I'm sure you're all familiar with. We were actually the company that invented smoke detectors for the home, and obviously that was a great success. Diversifying over the years, we went into the field of environment, and then with very successful products there too, and then just 24 years ago entered the field of health technology with Juice Plus and the Juice Plus family of products. And of course we feel like that was the find of last century as well as this one, not only for our own health and well-being, but for the people we love and those that we come across on a daily basis. So tonight we're going to talk about that product and some of the things that really I think are great to know in protecting your own health and those that you care about. And we have a great speaker with us. I've always admired her a great deal. We're fortunate that we work alongside her, and that's Dr. Tamara Sachs. She is a National Marketing Director within our own team, and she's our very special speaker this evening. Just to give you a little background about Dr. Sachs, she's an MD from New Milford, Connecticut. She specializes in internal medicine as well as functional medicine and integrative care. Dr. Sachs graduated with honors in 1985 from Mount Sinai School of Medicine and completed her internship and residency in internal medicine in 1988 at St. Raphael Hospital and Yale University. She studied naturopathy in France for 3 years and is a graduate member of the Institute of Functional Medicine. Dr. Sachs worked as an emergency medicine doctor for 4 years and started her private practice in 1990. She has served on the advisory boards of several organizations, including Women Heart, the National Coalition for Women with Heart Disease. So she's especially skilled in the knowledge of, just cardiovascular disease and heart health, but very knowledgeable in all areas. And tonight she's going to talk to us about something that's very timely, and that's the name of her talk is The Heart of the Matter. And as we have just all enjoyed and experienced Valentine's Day, I think it's a very appropriate time. Certainly that's a day we all take to tell those people we love how much we care about them. And it's a great time to take time to really think about the people we love and how we can make a difference from a health standpoint when it comes to the heart, as well as the entire body. So, Dr. Sachs, I'll turn it over to you, and maybe you can share with people some of the things that I'm so impressed with that I've heard you say in the past. Okay?
Well, thank you, and thanks everybody for joining. It's always nice when people care enough about their health to give up an evening, especially a Monday night out of the blue. So thank you all for being on. Some of you have, I recognize some of the names, so some of you have heard me speak before, and so we wanted to bring some new information to the call this evening. It is Heart Month, so it's fun to be able to speak with you guys almost every year, it seems, right, Cheryl? While we do this. But unfortunately, the statistics haven't gotten a whole lot better since we've spoken in the previous years, in that it's still the #1 cause of death everywhere, in every part of the world. And while we have gotten a whole lot better at treating it and keeping people alive who suffer with heart disease and have heart attacks and strokes, we've improved there, but we've done terribly in terms of what we call the incidence. So more and more people have developed heart and cardiovascular disease and are developing it at an earlier and earlier age. So the way I do my math, I think that's a lose. I think that's not a gain, even though you can flip the statistics to make it sound like fewer and fewer people are dying from heart disease at certain ages. That's true because we're treating them, but more and more people are living with chronic cardiovascular disease, and that's sad, and that's not, and that's frustrating as well as sad because it's so preventable.
And when we talk about cardiovascular disease, what exactly are we talking about? I mean, I have that connotation of a heart attack, that's in my mind, I guess what I would think of. But, if we look at that overall, what exactly does that encompass?
Yeah, I'm glad you said that because I think defining things is important. And I will bet you anything that on this call, 2/3 to 3/4 of the people on this call have been personally affected by cardiovascular disease, either themselves or in a very close family member. So cardiovascular disease is just what the word implies. It's all the diseases having to do with the heart and all the blood vessels of the body, because that's really a system. It's a circulatory system. It has a specific job to get fresh blood to every single individual cell in your body. That's a huge task. And also to pick up waste away from every single individual cell in your body. So the circulation is the task, and the heart and the blood vessels are the way we do that task. And so diseases that affect either of those, and so those include a lot of things that you may not think of. Yes, we think of chest pain and heart attacks. That's the most obvious and certainly a hugely important one. But TIAs or strokes or mini strokes are also cardiovascular events. They involve the blood vessels of the brain. And dementia, a large percentage of dementia is not Alzheimer's, but is in fact what's called multi-infarct dementia, or multiple teeny microscopic strokes over time that gradually look like dementia, and there's no treatment for that. It's also a cardiovascular disease. Lots of other things are. Some kidney diseases are, a lot of the problems that affect diabetics with their extremities, and also the famous Swagger commercials on TV, erectile dysfunction is a cardiovascular disease. It's anything where blood doesn't get to where it needs to go is a cardiovascular disease, either because the heart can't pump well enough, like heart failure, or because the blood vessels themselves are either narrowed or inflamed, or they rupture and they bleed, such as a stroke. That's the whole kit and caboodle, and that's why it's the #1 cause of death, because it includes all those things.
Well, to hear it being #1 cause of death, and we hear that more and more, that people are living with cardiovascular disease as a chronic condition, and yet we keep reading things like it's so preventable. And why is this happening if it's preventable 70% of the time?
I agree. That's a good question. I don't have the answer to that. Why is it still happening more and more? Because change is hard. Come right down to it. Change is hard, and changing the way you eat and the lifestyle you lead is hard, even if you know better, and that's true for all of us, myself included. Nonetheless, we know that simple measures that we've all heard before could reduce the risk hugely of heart disease, and then a whole bunch of other risk factors that maybe you haven't heard of before, or that you didn't realize were as important as they are, will reduce that risk another 10 to 30%. So we all know smoking is bad, and there are people that still smoke, and there are people that have heart disease. No surprise there. But let's assume everybody on the line is smarter than that, and no one on the line smokes anymore. But I will mention them a little later if you remind me there's an antidote somewhere. But the other thing that's really, really important is diet and lifestyle and how we handle stress. There was a new study recently. I put it on my Facebook page. I don't know if anybody saw it, but very well done epidemiological study showing that lack of exercise is worse than being overweight, and even more importantly, if you are normal weight, not exercising increases your risk of dying twofold over being overweight but exercising.
Oh, wow, I didn't know that. I better get with it.
So all of us that have said to ourselves, oh, I don't have to exercise, I'm pretty good, I don't have to lose weight, I'm okay, that's exactly the wrong idea. Moving your body 20 to 30 minutes a day, there's nothing that comes close to the benefits that gives people. So we know that, and people still don't do it. And then a big, huge one is diet, and diet is certainly controversial, but there are umpteen studies showing Mediterranean diet, the Leon study diet, many, many dietary intervention trials, we call them, have shown beyond a shadow of a doubt that those diet interventions lower heart disease better than most medication trials and quicker. and more effectively both for preventing initial as well as secondary heart problems. So we know what to do. Doing it isn't always so easy. And then there's a whole huge other area of research that's as important in connectedness and in our personal internal dialogue, if you will, with ourselves, having huge risk factors for heart disease. So we all have stress, but how you perceive that stress as well as how you handle it has an enormous implication with heart disease. It turns out that our heart talks to our brain much, much more than our brain talks to our heart. Wow. Literally, there are more connections going from the heart to the brain than the other way, and that the stress connection is huge.
Well, and, you know, we've always realized that stress is, maybe not always, but it seems like more and more, that seems to come to the forefront. You hear doctors, you certainly read about it, and people talk about it, that stress is, you know, such a major factor in health and health issues. So that makes total sense that, you know, I just didn't have any idea, though, that was connected that way. It's interesting. But we certainly see stress as something that is very difficult for the body to handle. And you were talking about diet, and, of course, there's a lot of conflicting information about diet and heart disease. So what and who do you believe in regard to that?
That's a great question, and that would be a call or hours unto itself as a discussion. But I will share with you categorically, without getting into any controversy, that every diet that's espoused for heart disease protection or general health protection, they may differ in detail, paleo, vegetarian, vegan, raw. There are many, but all of them are based in vegetables. All of them are based in produce. All of them are based in real whole foods that have been unprocessed and primarily colorful fruits and vegetables and berries. So the detail I will leave to another conversation, to other experts, you know, whether it's this or that. But every single health authority on the planet, from the World Health Organization on down, agrees that specifically servings of colorful fruits and vegetables, specifically fresh, raw, have incredible benefit in all diseases, including in cardiovascular disease. In fact, it was the #1 most important part of the Mediterranean diet studies and the Lyon Health study.
Well, then the next question would certainly make sense to be, how do fruits and vegetables and berries protect the heart and blood vessels? Why is all of the information, you know, pointed in that direction, and why do we hear that from every possible diet and recommendation now on the planet?
That's the question, and it's a real good one, because I have said the same thing when I've given talks on cancer prevention and treatment, on arthritis prevention and treatment, on, you know, you name it. It's because fruits and vegetables supply some very, very basic building blocks that the body cannot function without. There's just no substitute. A dear friend of mine once said something to the effect of, people think that fruits and vegetables are optional, like they have a choice about eating them or not. They're not. It's what the cell is designed to live on and to take in as nourishment. So fruits and vegetables and berries provide the antidotes to the main causes of chronic illness, and they also supply the nutrients that we need to not just function but to thrive. And the major causes of diseases that they are antidotes to come right down to inflammation and oxidative stress. Oxidative stress being a fancy term for when there's more free radicals than there are antioxidants. The result is oxidative stress. And those two things, inflammation and oxidative stress, and they feed on each other, by the way. They go back and forth. They play with each other. They antagonize each other. Those two bad processes, if you will, have been found to underlie all heart disease, all cardiovascular disease, because they affect the cell involved in that system. The basic unit that makes the circulatory system function is a little cell called an endothelial cell. And we know that fruits and vegetables supply the endothelial cell with everything it needs to withstand the trauma of being a little endothelial cell, and to balance out the free radicals and the oxidative stress and the inflammation that normally happens. And without those fruits and vegetables, those cells get damaged, and then the beginning of hardening the arteries, the beginning of blood pressure problems, the beginning of infiltration of cholesterol underneath the wall of the artery, which starts the whole plaque process. All of that stuff starts to happen when there aren't the nutrients and the protective value of fruits, vegetables, and berries, not just in endothelial cells, but in every cell in our body. But we're focusing tonight on the little endothelial cells.
Well, you know, being with Juice Plus for some time now and having heard you and many other doctors talk, we hear the word endothelial fairly frequently in association with the cardiovascular system and endothelial dysfunction. I've heard Dr. Du Bois say that. What exactly is that? Endothelial dysfunction is a mouthful. And so we lay people out here don't really know a whole lot about that, but I'll hear, you know, Dr. Du Bois say it's so important for endothelial function and you don't want to have endothelial dysfunction.
There you go. Dr. Du Bois, one of my heroes. You know, I think that a lot of what he and I both do and what I think every good doctor does is teach people how their body really works. Because if you understand a little bit about how your body really works, you can obviously make sense of things and think things through and make, therefore, better decisions for your health. So not to bore you all with silly biochemistry and stuff, this is kind of important, I think, because little endothelial cells, if not for the fancy word, it's really just a simple thing. I mean, if you just imagine your heart and all the blood vessels that connect you from one end of the heart to the other, right? They go through all parts of your body, down smaller, 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 until it gets to the level of one cell. That's a capillary. And then at that point, it exchanges what it has to exchange, blood that has information and hormones and messengers and oxygen and nutrients and instructions for the next move and everything you need for that cell, and it takes up all the waste and the products. So a cell might make a hormone or make a messenger, and the bloodstream has to pick up that product and move that to the next place. So that's the system, right? And the way that works, it's not just plumbing. It's really responsive to you know, your position, to whether you're racing for your life or whether you're lying down calmly watching TV. And the way it's so responsive are these little cells that kind of get feedback from all over the body and know just what to do to shunt blood in the right place by constricting an artery and making it small and raising the pressure, or dilating an artery and making it big and lowering the pressure and shunting blood to a different place. And that is the magic of an endothelial cell. They're very smart. And if you visualize them, they're literally like a sunny-side-up egg. A sunny-side-up egg, nice and flat, with the nucleus being the yellow in the middle, one cell layer, just imagine a wall of sunny-side-up eggs lining every single part of your heart, your arteries, your veins, your capillaries. That's everything is an endothelial cell. And that's what the system is. And so the endothelial cells have an incredible capacity to make messenger chemicals, to constrict things, to vasodilate things. They produce dozens of different compounds to instruct our body as to what to do and when. And they are just fundamental to the flow of blood circulation everywhere. So you're only as old as your endothelial cells. You're only as vital as your endothelial cells.
That's amazing. I mean, as I listen to you, you know, it sounds like a massive computer that's by far more intricate and brilliant than anything we would know
far more
in the way of computers. But it's fascinating to think of, you know, just the magic of the body and what we are capable of if, you know, given the right input. So let's talk about the input. We talked about fruits and vegetables, and tell us a little bit more about what we can do to make sure that we not only take care of our bodies, but how we can, you know, maintain really good health and then, of course, heal or repair. I think that's huge, too, as far as our bodies are concerned, is healing and repairing.
Absolutely. So inflammation, back to inflammation and oxidative stress, because they underlie everything, and the antidote to those things, it's a bigger talk than just a little quick talk, but part of the antidote to inflammation is turning off the signals that are causing inflammation and providing the nutrients to neutralize it, and that's what fruits and vegetables really do. They do both of those things. They give the signal and provide the nutrients. Very few things do both, and the same is true for oxidative stress, and the same is true for the other big bugaboo that makes us age and get sick and have lots of symptoms and extend the end of our lives into symptom zones as opposed to being vital up until the time of the end of our lives, which is what we all hope for. The other thing is is toxicity. And toxicity comes in lots of different forms, and it's not just the buzzword that we hear on, on magazines right now, but just the ongoing act of keeping the body young is in large part keeping it clean. And every day we breathe in and out, we have to expel the toxic materials that we create in just the act of living. But on top of that, we now live in a planet that has record amounts of toxins, many of them, 80, 90,000 of whom were never even present 60, 70 years ago. This new age plastic, petrochemical toxicity, lead, mercury, and all the rest is really taxing our nutrition and our ability to handle that toxic load. And nutrition is, again, the only way to safely metabolize, excrete, process, and get rid of toxins. So we need more fruits and vegetables to balance out the stressful life we live, the fact that a lot of these diseases are getting worse because of our environment and because of the lack of healthy nutrients in our normal food supply. It's just getting us from all sides, and so the need for more and more dense nutrients has just never been more important.
Well, and again, I think it's great that we get this knowledge and that we hear this because, as you said, it would be simple enough, you would think, to do, but yet it seems to be hard for people to come by on a consistent basis. Now, one of the other terms that I hear you and Dr. Du Bois and others talk about when they talk about cardiovascular disease or other illnesses are biomarkers. What are biomarkers to begin with?
Yep.
And then what are some of the biomarkers in cardiovascular disease?
Good question. So when I talk about inflammation and oxidative stress and how I know that fruits and vegetables and other things can raise or lower those, it's because we can measure them, and that's what a biomarker is. It's a way to look at some biological system and measure some function or some functionality. So when we're trying to look at inflammation, for example, it's a huge system. And inflammation isn't one thing. There's, acute and chronic and, all sorts of different forms of inflammation. That's how come we survive on this planet for this long. So we try to look at it, we try to look into the body by tracking what we call biomarkers, markers of certain specific situations or conditions like inflammation or a revved up immune system in one way or another. So we can look for markers that represent those different situations in the body. So bio just means biological. And so some biomarkers are really good and some biomarkers aren't. and most of the time, which is always the case in medicine, a lab is only as good as the context and the interpretation. It's not absolute. Labs are just not absolute numbers. They always have to be interpreted in the context of a person. So when you put 6 or 7 different biomarkers of inflammation together and you look at one person's inflammation panel, you can probably say something intelligent about their inflammation level. If you just look at one marker periodically in time, it's like a snapshot of Niagara Falls. It's moving, it's changing. It really doesn't tell you very much. So there's a lot of ways to look at biomarkers that are intelligent, but you have to keep in mind that they are not absolute. Having said that, all the studies that we do look at biomarkers. And so cholesterol is a biomarker. It's gone out of fashion, if you will. It used to be in the 50s and 60s the only biomarker we looked at for heart disease, and now we know that well over a good half of heart attacks have normal levels of LDL cholesterol. We've known that since the Framingham studies 35 years ago, but no one seems to be paying attention until just recently when we realized that it's not the cholesterol that matters, it's whether it's oxidized. So now we can look at a biomarker called oxidized cholesterol, and that helps, but oxidized LDL cholesterol is even a better biomarker. So as we get better with science, we find better biomarkers, and we learn how to interpret them and follow them over time. And that's what I do in the office, and that's what a lot of the studies that people have done on Juice Plus over the years have tracked and looked at are biomarkers of medical conditions and or health.
Well, and again, we get to the research, and I think this is where we might want to share with people, what does Juice Plus research show regarding cardiovascular disease, because obviously there's research in that area as well as many other areas.
There certainly is. There's like a ton. In fact, it was one of the reasons I first became involved in Juice Plus many years ago. And was it 7 years ago now? I did a talk, and at the time there were 5 studies that looked at cardiovascular markers in Juice Plus. We now have We now actually have 9 studies that look just at heart markers, but there's actually 24 separate studies that include cardiovascular biomarkers in them that show improvement. So that's pretty impressive, and only in a few short years. We have over 35 studies altogether, and I mean studies. When I say studies, me as a physician who's done research, I mean real studies that are published in peer-reviewed journals that had been vetted by colleagues and that had been reproduced over time. But in just heart disease alone, we have 9 I mentioned. What's interesting is that we have Australia, Germany, Tokyo, Sydney, Australia, 3 in Italy, and 2 in America, at Vanderbilt University and University of Maryland. And the University of Maryland study was done a few years ago, and it was published in the most prestigious cardiovascular journal, at least in this country, maybe in the world, called the Journal of Cardiology. So we have a huge body of published literature in cardiovascular disease and Juice Plus, and all of it shows benefit. And most of those are biomarkers of oxidative stress and other cardiovascular markers like homocysteine. I think that the research is really important. It's what got me involved. It's what I use when I speak to my colleagues, and it's what gives me a tremendous amount of confidence over the years, especially in the beginning. Honestly, I have my own 15, 16, 17 years of research in my office with lots and lots of labs and patients who've seen improvement. So I rely on it less, but I have to admit that I wouldn't be here if it wasn't for the research initially. But I think it's fair now to say that unlike research on a drug or a specific unique thing, research on fruits and vegetables and Juice Plus has now been around so long, it is so overwhelmingly positive, has absolutely no negatives, is so obvious, has such a solid theory behind it. In other words, it makes sense why it should work, and over and over and over and over again, it works. I think we can kind of put the research behind us, except for those of us like myself who are nerds and like to read research. The rest of you don't need to read the research. You just need to know it exists and be proud of the fact that this is a company that invested that much money in the research without any guarantees. They agreed to publish no matter what the results were over 30 times. That's unheard of in this industry, and it's to be commended. And so 30 times they did not know if it would show that they were good or not, but it did.
And, we certainly are blessed with this research because certainly just the technical, I guess that would be the right word, or the depth of it, the explanation of it is very intricate. So as a layperson who's not, medical, I love that it comes right behind me. If you say put it behind us, let's put it right behind me, because then, it's a wonderful thing to validate what I'm saying. Yeah. But I don't have to know it word for word. I couldn't know it word for word, but I do like that I know where I can get it and that I can hand it to someone or show it to someone. If they feel they need that information, if they are medically minded, I'll have to share with you all. I've had the same dentist now for 24 years, and we've actually had Juice Plus that long. And, I've had very good success with gum health and things like that, and I go in from time to time, not that often. But I have mentioned it over the years, and, he's, oh, that's nice, but not pay any attention to me. And then recently, I went in for more or less just a checkup and that sort of thing, and brought him the periodontal studies. And all of a sudden, the whole picture changed. I mean, he says, this is such a prestigious journal. Are you really in this journal? I said, well, you can read it probably better than I can because it's your field. And so now he's going to share Juice Plus with his patients after all these years because the research was so impactful and so compelling. And I still get tickled when I look at his face saying, this is a very prestigious journal. You just don't get in this type of journal by accident, And so, I can't help but be, tickled and amused, but very impressed that we would have research that would validate what we're seeing and what we're saying and what we're showing to people. And I know that a lot of the research has been funded from different directions. Is it the National Cancer Institute, am I right on that has funded, quite a bit of the research. So obviously they're people out there who understand the power of what this is and are happy to investigate it to the point that it proves, what we are seeing. So talking about what we are seeing, you've practiced for 10 years of regular medicine as a primary care doctor and 10 years of medicine as a functional medicine and integrative doctor. Beyond the research, what have you seen? What have you learned? I mean, if we take all these things that we're talking about, because I love that somebody can explain endothelial dysfunction and, what are biomarkers and things of that nature, but when it comes to our day-to-day lives and we look at the people we love and our friends and our neighbors and those that we come across, what do you see in your office and with your knowledge as far as Juice Plus is concerned on a day-to-day basis? And what have you seen as far as medicine is concerned?
I've been so spoiled to have Juice Plus as part of my integrative practice from the get-go. I really am convinced. Don't let the word out, guys, but I think a huge part of my success has been that secret weapon. Because I've had occasion now over time to have people take Juice Plus, stop it, change it, do all sorts of different things. I have a nice longitudinal, as they say, way to look at people and families, in fact, on Juice Plus, because I have been using it as part of my practice for over 15 years now. And I love labs. I just love getting objective data, and so I get a lot of labs. So I've seen some pretty amazing stuff. And I would just back up for just a minute. I wanted to just make the point, because I realize that most of you don't know this, but the way research gets done, for the most part, ideally, is because things happen at the bedside, like what I'm about to tell you, stuff that I see as an actual doctor face-to-face with actual people. When enough of us start to see the same thing, that's what prompts a study, to see whether, in fact, that's just quirkiness or if that's, in fact, reproducible, and that's the word we use. And so something's reproducible across other places and in studies, and so that's why I kind of pointed out that the studies on heart disease are done in, 4 continents here? We got Asia, Australia, 4 continents, and they all show benefit. That's even more impressive than 9 studies in the same university. So I've seen stuff that a few years ago, 10 years ago, I probably would have been embarrassed to even say because it would have been too good to be true. But I have the confidence now to share stuff with you and tell you it's not too good to be true because I see it over and over and over. And so I see people sometimes feel better really fast and sometimes take a very long time to heal, and that's just the way life is. That's true for lots of things. But I think it reflects the fact that we're all obviously different, but also have different nutritional scars, if you will, sinkholes, issues from our past that have caused huge nutritional rifts, past surgeries, multiple babies, lots of breastfeeding, all these kinds of things that are good or bad, chemotherapy, they add up and make us more or less nutritionally resilient. And so then you give somebody Juice Plus, which is such a concentrate. I mean, even people who eat really, really well, like the Australians who were in one of these studies, even people who really eat a lot of fruits and vegetables, they don't eat Juice Plus. It's really almost impossible to get the nutrition of Juice Plus without Juice Plus because you don't eat the skin of your orange. You don't eat the seeds and the stems of your grapes. You know what I'm saying? We make Juice Plus with as much of the whole food as possible, and it's vine ripened, and it's grown solely for the purpose of being the most nutritionally dense food available. And it's processed immediately within 24 hours. Everything is done to make it the most nutritionally dense powder as possible because they're going to be tested out there in the real world and in clinics and in university centers all over the world that we had no control over. So we have to make an incredibly powerful product every single day so that it can continue to do what it's been doing in 36 studies and show how good it is. So my point is you can't eat this stuff. So even it surprises me. The people I give Juice Plus to who see incredible improvement, even when they eat well, they may have tremendous nutritional deficits that Juice Plus fixes. And then there's the other side of the coin where, because of the way the body is, it may take months and years, literally years and years, for Juice Plus to work some magic or prevent some problem or help heal something, for example, bone density, which takes a very long time to heal, chronic ulcers in diabetics. I've seen those things heal over time, allergies, as well as I've seen things heal really fast. So I've seen all sorts of different things in Juice Plus, but I am so convinced that it is my secret weapon. It is the most powerful nutrition I can give people that's absorbed even when people are incredibly sick. I've given this to people who are very sick. I'm trying to think of an example that won't freak people out, and I can't, so I'll just leave it at that. Unstable, in the hospital sick, right after surgery sick, bleeding sick, still very, very ill, and their cells are able to not only absorb it, but use it to help them heal faster. I've seen Juice Plus do marvelous things, not because Juice Plus is so marvelous, just because the human body is so marvelous, and when we feed it right and give it all the nutrients, these micronutrients that we need, not in large amounts, but in this huge variety from fresh, colorful produce. That's what we're designed to eat. When you give that back to the body, amazing things happen, but not always super fast and not always what you think. And you have to give it time to make up for all the time that it took you to get ill or injured or scarred or what have you.
Well, and of course we see over the years, I've not missed Juice Plus a day in 24 or so years that we've had it, and I certainly feel like and know that it's given me my edge physically. And we see so many variations of what it does with people in all areas. Like you said, there'll be people who will, have results. They feel it almost immediately. And then there are people that it can take a really long time depending on the thing. A story that I rarely share about myself, but every now and then I do, so I'm going to do it right now, is that my family is very prone to osteoporosis. It certainly is something that both my mother and father dealt with, and I lost them at a very early age, so I don't know exactly how much more severe it would have become, but it was already severe enough when they were in their 50s. And so when Juice Plus first came out, it was just coincidental. I had my first bone scan, and at that point I had lost what they were saying was 21% of my bone mass, and that was, huge. And they wanted to put me on something called Fosamax, and fortunately I didn't do that. I have learned since that that's been taken off the market because it caused cancer. So, there's certainly the side effects of things, but, I was afraid of medication because that's what I'd seen happen with my parents. And so I guess I was just trying to ignore it, okay, which is probably not always the best idea, but
we all do it.
Anyway, I'll ignore it. And but what was really interesting and unexpected, I had a bone scan every 2 years. In the first 2 years, nothing changed. It didn't get better. It didn't get worse. 4 years, though, they began to show that I was reclaiming some bone mass. And 6 years, my bones were appearing quite healthy. And we really couldn't find it any other reason. I mean, I'd like to say I exercise, but I've got to get better at that. I really can't say I'm consistent in any way. And there's not anything else that I take or consume in the way of medication or supplement or anything of that nature. So by the time I was on this 8 years, my doctor finally said it's got to be that Juice Plus stuff. I mean, we can't find any other reason. So for me, this has been really beyond just a blessing. It feels like a miracle in a sense, because I would have a whole different life challenge that I don't have. And there's no way I can see my skeleton or really feel what osteoporosis is doing until it becomes something that, is really in a bad way, I would imagine. So, I think that if I'd had no other experience, even though I've had great experience with this product, energy and really good health, but if I'd had no other result but that, it would have just been amazing, but there would have been no way for me to tell anybody that or know that without actually bone scans happening, or because it couldn't be from the way it felt.
And that's my concern when people share their stories of miraculous, wonderful things with Juice Plus, and there certainly are tons of those, and they're real. But there's as many people who, don't feel anything. I honestly didn't feel anything when I went on Juice Plus 16, 17 years ago. I didn't. I noticed it when I stopped, and I got my chocolate cravings back. But other than that, I didn't feel a thing. But I know because I know what I know. I read the research because I understand cell physiology, because I understand how the body works. I've never missed a day. I will not, I will miss my other supplements, and I take several, but it's the only thing I will get up out of bed for if I've forgotten to take my Juice Plus, because I know too much. I know that it's the most protective supplement that I have. Everything else is good and may be important, but this is the foundation. This makes everything else
and I
work
think
better.
that's the word that we really should underscore. It's foundational. It is the foundation to everything that, the body needs to really function at its highest level and live at the highest edge of your physical existence. And you alluded to something just now that I heard you say once, and I'll try to quote you, okay? Because I've so admired, the years of study that you've put into your career, to the things that you do, and your career to help people on a daily basis and what you see. And I think I heard you say once, if you knew what I knew, you would never be without Juice Plus every day of your life. Am I getting that right?
You're close. I think I said if you knew that anyone you love.
Wait, say it again because we got that little beat.
So, because we all do things for other people more than we do for ourselves, right? So for your grandson, what wouldn't you do, Cheryl? And I hope that you would exercise for him, if not for you. But so I think what I said is, if you knew what I knew, you would never let a day go without the people you love eating fresh fruits and vegetables and taking their Juice Plus.
I think that should be written on the wall in everybody's house, okay? So it sounds like we're just about out of time. I really so appreciate your time, your input, your knowledge, and your gift of sharing that with all of us. And I think we're very blessed, all of us on this line, to have Juice Plus, and I think it's really a moral responsibility to share it with other people, because I truly think we are the difference in the world that is going to help people with all the challenges that we see and hear on a daily basis. So we'll say goodnight to everybody before the line stops us. And it was great talking with you, Dr. Sachs, and for everyone on the line, just great having all of you here with us as well. So good night, folks.
Thanks for the chance. Good night.
Good night, everyone.
Bye.
Bye. Bye. Bye.